So I'd like to introduce next my colleague, Dr. Amanda Frizz. Amanda is an assistant professor. She just joined us this autumn, and we're so thrilled to have her in the department. Amanda specializes in the rhetoric of health and medicine and science and technology studies. So as well as kind of particularly queer feminist STS, or science and technology studies. Her research utilizes rhetorical criticism as well as rhetorical field methods to examine rhetorical scientific constructions of women's sexual health, broader public understandings of health and medical science, and vernacular bioethics. So I'm going to turn it over to Amanda to share with us a little bit about her current book project.
Thank you so much, Christine. So I want to start by acknowledging that even in 2021, women's sexual health is still a taboo topic, and the state of the research is dire. It's stymied by silence and stereotypes. As some examples, people who experience vaginal pain during intercourse are often diagnosed with dyspareunia, which is a diagnosis that simply means intercourse is painful. In 2015, a group of researchers announced they had discovered a groundbreaking treatment for dyspareunia, lidocaine. In essence, the researchers just suggested liberal application of numbing agents. A survey of college-aged cis heterosexual women asked how they defined satisfying sexual encounters. And the number one response on that survey was, it was successful if it wasn't painful. The second most common answer, it was successful if their partner climaxed, but not if they did. And finally, the fastest growing plastic surgery is labiaplasty, or alterations to the visual appearance of the labia to look more like a Barbie doll. And the procedure is nicknamed the Barbie. And people who get this surgery say it is necessary in order for straight men to find them attractive. So there's clearly a great deal of ignorance and anxiety surrounding women's sexual health and women's sexual practices, and an even greater need for better research. Diagnoses of sexual disorders are broad and vague, and treatment options are limited and often ineffective. So for these reasons, women's sexual health has been identified by the FDA as a top 20 area of unmet medical need. So as a rhetorician, I believe a vital part of improving the state of the research is a close examination into the rhetoric around sexual health. And sexual health is a great case study for rhetoric because it's something that straddles the line between biological instinct and social construction. And it is riven through and through with power. So I ask a lot of questions about the language that we use when discussing sexual health and the assumptions that underlie that language. So questions like, how is sexual desire defined as a medical problem as opposed to a personal or relationship or other kind of problem? Or how does sexual appetite come to be seen as healthy or unhealthy? And most importantly, who gets to decide? So in my book project, I look at 3 case studies, which I'm happy to discuss in more detail in the Q&A. They each are wild on their own. But in general, my first case study examines a new prescription medication called flibanserin. You might know it from its brand name, Addyi, which purports to treat absent or low sexual desire in cis heterosexual premenopausal women. So I examined the testimony from married women who petitioned the FDA to approve this pill by arguing that their lack of desire for their husbands was a medical condition requiring medical intervention. My second case study focuses on the efforts by activists and artists to center the human clitoris by circulating models of the organ made with 3D printers. And my last case study examines a website that purports to teach women how to obtain sexual pleasure by providing interactive touchscreen tutorials. So across all of these case studies, I see pleasure figured as the criterion for determining healthy sexual appetites and sexual health. Scientists, physicians, and therapists all measure a healthy sexuality by gauging pleasure. Are you satisfied with your sex life? And yet desire and pleasure are also figured as suspicious lusts that must be carefully scrutinized and controlled. So some of my research has delved into the history and the ways that our present day anxiety towards women's sexuality is actually an inheritance from a very long history of suspicion toward the flesh and its pleasures. And what's interesting is from about the 1600s through the Victorian era, rather than men being sexually insatiable and women being sexually pure or asexual, it was the reverse. Women were the insatiable, lustful creatures compared to men, who, as bearers of civilization, had the willpower and the refinement to hold their baser instincts in check. So, in this Victorian era, the image of the nymphomaniac loomed large. Women could be diagnosed with nymphomania for discussing marriage too frequently, or for being divorced, or for being widowed, or for wearing too much rouge, or for expressing attraction to other women. Victorian physicians frequently were warned about the female patient as seductress, a nymphomaniac who sought to entice the physician into a gynecological exam. So when patients presented to the physicians with random objects lodged in their bladders or urethras, the physicians assumed their patients had used the objects and the subsequent exam for sexual excitement. When these patients explained that their presence there was the result of sexual abuse, the physicians dismissed those explanations as extraordinary stories and lies. One British physician claimed that you could identify the nymphomaniac because she was always pretty, vain, and a decided liar. Fast forward to the 1960s and 1970s, not much has changed, but also there's a new problem. The woman who don't like sex enough, the woman who doesn't worship her partner's body, doesn't like porn, doesn't engage in casual sex. Now women must adhere to a hypermasculine ideal of sexual desire that not even many men truly exhibit. And now there's an incredible pressure on women to be orgasmic, to be available and willing. And this tension continues through to today. The panic, on the one hand, over women with uncontrollable lusts and urges and lies, and on the other hand, the lament of women who eschew pleasure far too much. So then, rather than thinking about pleasure as a form of measurement or a criterion, in my book, I argue that we should think of it as a form of communication, of intra-body communication. And pleasure and pain are the body's innate languages. So my research examines ways that the body uses its native language to communicate with itself, including with the subject that we call I. So the etymology, let's bring this back to communication, and the etymology for communication is the word communion and the verb to commune or to be with. So part of what my research asks is, what would it mean to be with one's body, to give room for it to speak its desires back to you? And I think opening such a space would not only expand the range of voices that we attend to, but it might also create the possibility for not just healthy sexualities, but liberatory ones as well.